This lecture is about the cardiovascular system. We will review the basic anatomy of the heart. We will then pass on to the main heart diseases, and we will focus on atherosclerosis, which is a major cause of cardiac events. I will then talk about history taking, and we will introduce the questions a doctor should ask a patient when he suspects a heart problem. Next, we will have a look at the main diagnostic tools and treatment options. So let's focus on the anatomy of the heart. With each beat, the heart pumps blood into two closed circuits, the systemic and the pulmonary circulation. The left side of the heart is the pump for the systemic circulation. It receives freshly oxygenated blood from the lungs and propels it into the largest artery in the body, the aorta, a word which means suspend, because the aorta was believed to suspend the heart. The right side of the heart is the pump for the pulmonary circulation. It receives all deoxygenated blood returning from the systemic circulation. Blood ejected from the right side of the heart flows into the pulmonary trunk, a large vessel which branches into pulmonary arteries which carry the blood to the lungs, whereas the vena cava takes deoxygenated blood from all the other veins into the heart. The heart contains 4 chambers, 2 atria and 2 ventricles. The pointed inferior end of the heart is called the apex, and opposite the apex, the wide superior margin is called the base. Each atrium has an appendage called the auricle and is separated by the interatrial septum. The atrioventricular valves lie between the atria and the ventricles. The right one is called the tricuspid valve because it consists of 3 cusps. The left one is called the bicuspid valve. Now, let's focus on the cardiac cycle. The phase of contraction is called systole. The phase of relaxation is called diastole. The time during which a much smaller volume of blood flows into the ventricle is the diastasis. The time when all 4 valves are closed again is the isovolumetric contraction. Now, let's focus on arrhythmias. The asynchronous contraction of the atrial muscle fiber is called atrial fibrillation. When the atrial rhythm is between 240 and 360 beats per minute, we talk about atrial flutter. The most ominous arrhythmia indicating imminent death is called ventricular fibrillation or VFib. With our next slide, we're going to have a look at the main heart diseases. The inflammation of the pericardium is called pericarditis and may lead to accumulation of fluid in the pericardium, thus compressing the heart. This compression is called cardiac tamponade and can stop the beating of the heart. A severe pain that usually accompanies myocardial ischemia is called angina pectoris, meaning strangled chest. The valvular abnormalities that may contribute to murmurs are mitral stenosis, mitral insufficiency, aortic stenosis, and aortic insufficiency. What may cause congestive heart failure is coronary artery disease or congenital defects. CAD is mainly due to atherosclerosis. Most heart problems result from faulty coronary circulation due to blood clots, fatty atherosclerosis plaques, or spasms of the smooth muscle in coronary artery walls. This is what we are going to talk about with our next slide. Atherosclerosis is the process in which smooth muscle cells proliferate and fatty substances like cholesterol and triglycerides accumulate in the walls of medium and large diameter arteries. The accumulated cholesterol, triglycerides and cells form an atherosclerotic plaque. On the next slide, we are going to try and list the main risk factors of heart diseases. Among the main risk factors, let's name age, family history, hypertension, hypercholesterolemia, male gender, smoking, diabetes, obesity, oral contraceptives, and sedentary living. I suggest we now review the questions you may ask a patient if you suspect a heart problem. But first, let's focus on patient's talk. A patient may use the word engine to refer to his heart. Like, my engine is not working properly, meaning my heart is not working properly. Your first question might be around eating and drinking habits. Do you eat fatty foods? How many drinks do you have in a week? You may want to know whether your patient exercises regularly. Your questions might be, do you do sports? Or simply, do you exercise regularly? You may want to know whether your patient feels palpitations, in which case your questions are going to be, do you have any palpitations? Or do you sometimes feel your heart skips a beat? You may also want to know whether your patient suffers from shortness of breath, in which case your question is going to be, do you feel short of breath when you exercise or when you rest? You may want to know whether your patient has pain somewhere. Do you feel any pain in your chest? Does it go anywhere else? Down your left arm? Up your jaws? Does the pain occur when you exert yourself? When you rest? You may want to know more about associated symptoms like sweating. Your questions might be, do you sweat more than usual? Do you sweat at night? Do you have any blurred vision? Do you have any buzzing in your ears? Something important is the current treatments that your patient might be taking. Questions are going to be, are you on or under treatment? Beta blockers, blood thinners, the pill? Do you have a pacemaker? Now let's pass on to the physical examination. During a physical examination, you will need to check the weight and the height of your patient, the body mass index, the BMI. Have a look at your patient's complexion. Search for edema. Look for scars. Check the warmth in your patient's hands. Check the pulse, the blood pressure, and then pass on to auscultation and percussion. To make your diagnosis, you may need more tests. Apart from the classical ECG, there are a couple of other diagnostic tools that you may use. Cardiac catheterization is an invasive procedure. It is used to visualize the heart's coronary arteries, chambers, valves, and vessels. It consists in inserting a flexible catheter into a peripheral vein or artery and guiding it under fluoroscopy. Cardiac angiography is also an invasive procedure in which a cardiac catheter is used to inject a radio-opaque contrast medium into blood vessels or chambers to visualize the arteries and ventricles. We can also use it to inject clot-dissolving drugs such as streptokinase or a tissue plasminogen activator. Coronary artery bypass grafting, or CABG, is a surgical procedure in which a blood vessel from another part of the body, usually the saphenous vein, is used to bypass the blocked region of a coronary artery. There are more tests and procedures available. With PTCA, a balloon catheter is inserted into an artery of the leg or the arm. It's guided through the arterial system until it's threaded into a coronary artery. Next, the balloon is inflated at the point of obstruction. Because 30% of PTCA opened arteries fail due to restenosis, a special device called a stent may be inserted to keep the artery open. And as a last resort, if someone's heart stops, you will need to perform CPR. It consists in applying cardiac compressions and mouth-to-mouth resuscitation. Thank you for your attention.